David, they say the most important thing to prevent transmission of the coronavirus is to disinfect your hands.
John, I'm not taking any chances. Welcome to Care Talk, your high-end home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, we got to talk about coronavirus.
We should.
Have China and other governments done a good job of corralling that thing?
Well, of course not. I mean, first of all, China did not own up to how big it was. All of the signs were there from the old SARS virus from a few years ago,
True.
Which got out of control, killed a lot of people. And now we're just, I think, at the beginning wave of this. But it's not just China. People attack China. I know you always like to attack
I like
China.
to do that. Let me add it.
But let's be honest. The WHO, the World Health Organization, slow walked its way to calling this a public health emergency. One of the things I think was impressive is the United States authorities, Secretary Azar, jumped in and did call it an emergency. And I think that what I don't think that these Chinese or the World Health folks took responsibility early on to actually take action. And now I fear that a lot of people are going to suffer, and you're seeing the numbers grow every day. And I think we're just at the cusp of really the cost, human and economic, of not taking this seriously.
John, I think you're correct about that. Don't let it go to your head. But Dr. Li in China, who was an ophthalmologist, who's kind of basically said, "Hey, you got to take this seriously." He actually died of coronavirus, and he was censored. What's happening?
He was censored, and he was actually asked to do a public disavowal of the truth, and that's the kind of craziness that I think is disbelief in the facts and not really leaning into what could go wrong. That has undermined the response.
Well, John, I think that's right. And one of the things that's strong about the U.S. is people can usually speak their mind without that type of retribution. I do fear under the Donald Trump era, the impeachment showed us that you go and you can basically take a whack at the witnesses and fire them. That's the type of behavior that actually gets you to undermining what's great about the society. And it's good that Secretary Azar was able to do what he did, but I fear for where we're going here in the future.
But I think that one of the advantages we have is an open press, an open system. You can crowdsource a lot of the data that then doctors and public health officials can take advantage of. So while there may be a little bit of a chokehold on the truth sometimes at the federal level, I think the feds have showed pretty well through the Secretary Azar. And I think this is really one of those fundamental advantages of an open society.
All right, I agree, John, but you will not let me make my point. You're trying to undermine me and the truth at the same time. Fair enough, John. We'll keep our eye on what's happening.
Yes.
But I want to ask you about something a little wonky, John, because I'm going to bring out, he's cute when he's wonky, so I want to show you this. So, John, is it getting harder to get Medicare home care?
Well, cutting through the details here are a little bit complicated because it goes to the fact that while certainly we at CareCentrix and a lot of others think that more healthcare procedures and more care could happen in the home, the federal government has looked to cut the total cost of home care in the Medicare programs for years because they're afraid of fraud, waste, and abuse. And so what they've come up with is
that's new, like R-rated movie, right? Is that what it is?
PDGM, basically patient diagnosis groups, so that to tie the treatment more closely to what the patient needs. And really, it really is aimed at aiming more of the healthcare that's delivered at home towards more of the sicker patients. Unfortunately, though, when you have these layer cake changes, there's probably a lot of vulnerable people who are not going to get as much physical therapy and occupational therapy as they need. Ultimately, the home care that's being delivered is a small amount of the dollars in the Medicare system. And when you make these changes, even well-intentioned, my fear is that there's a lot of folks who are vulnerable who need it.
They showed some examples I saw in the paper about, an ALS patient. He wasn't getting better, and so they're going to stop his therapy. Well, an ALS patient doesn't get better. They try to just decline more slowly,
gracefully, and so I think it's a cumbersome regulation. It's been mitigated a little bit, but I do worry about it.
Well, the thing is, John, I think also Medicare Advantage isn't affected. So maybe for folks that are concerned about it, that is actually one way to insulate yourself.
And so David, I was reading in another one of the medical journals that there's some concern.
You can say it was the National Enquirer, John. No one's going to judge.
It was the New York Times, and there's been some other places.
What's the difference?
Where pharmacists are increasingly worried about their ability to actually do their jobs.
Yeah.
Do you think your pharmacist is doing his or her job?
I think she is, although
Doesn't
I think you
look
just
like it.
changed out pharmacists. They always give me that little purple pill.
Well,
I'm
that
not
could
sure
be
why.
your wife. That's your wife.
That
That's
could
not
be
the
John.
pharmacist.
Yeah, she's not the pharmacist.
But what about this issue of kind of the pressure on pharmacists and whether there's a risk of a mistake?
There's always a risk of a mistake. I mean, pharmacists are pretty careful. They're the most well-educated pill counters that there are out there. You know, go through 7 years of education, and then they're counting pills. And they work for chain stores, and a lot of them are complaining that maybe they're being worked too hard. They might make a mistake. There's too much pressure on them. It's hard to say, John. I don't see there's very good statistics on this.
It doesn't sound like you really know what you're talking about.
I don't really know
but
much.
at a minimum,
Yeah.
everyone who gets
What else is there, John?
There's always risk of drug-drug interaction.
Right.
You should read all those lugubriously detailed
It's too long.
notes about what any other condition that you might have. Check that you've got the right pills in the right bottle.
How am I supposed to do that?
Open it up and ask the pharmacist.
All
I mean,
right.
it's really not that complicated.
No.
But you should, it's sort of the most important thing in this is I think that most pharmacists are actually quite trustworthy, but there's always a risk of a mistake. Know your drugs and make sure you're asking the right questions. Be an empowered consumer.
I think there's just so many millions of prescriptions out there that of course there's going to be some error somewhere. But my pharmacist does a good job. They seem careful. I haven't heard about any
Take control
mistakes.
of your destiny by
All right.
knowing your pills.
I will do it, John. Amen, brother. Speaking about getting serious and taking control of our destiny,
Yes.
how about the price of these old pills?
Well,
Are we getting
that's
serious
insane.
about
No,
that? I
we're
love
not
this. It's a
getting-
good topic,
we're not
John.
getting
Come on.
serious.
We are. Look,
think-
if Trump put a serious face on, he's serious about it.
Well, I will say that the proposal that's in draft form from the federal government to actually tie drug prices to inflation is
Yeah.
actually a pretty constructive one, given the fact that drug prices go up even though their costs go down for all the standard pills every month. I mean, the reality that big pharma can raise prices on drugs with no innovation every month is crazy, and it has led to the fact that so many Americans can't afford their drugs. But we'll see. I mean, the president has asked for a bill. It's unclear whether he's
I
going
don't
to
think he wants
actually.
it. Yeah, give me a break.
Yeah, but I think that Americans are very serious about drug costs. I'm not sure the federal government is.
All right. John, are you serious about standing under a tree when the lightning strikes?
It's time for the lightning round.
Okay.
So, David, what did your President Donald Trump learn from the impeachment process?
John, I think he learned he could grab the whole country by the you-know-what and get away with it. What do you think?
Nothing.
You think nothing?
I think nothing.
Very good. John, should the VA put the vets on the keto diet?
What's that?
That's like a bacon diet, John. It sounds pretty good to me. It's supposed to be good for you to lose weight.
You're
believe it or not.
supposed to know the
Like
answers
the
to these
Atkins.
questions. Keto is where you shift away from carbs into more proteins. Look, the VA has 1 out of 4 people
Yeah.
who get services through the VA that are on diabetes, much higher than the general population. This keto diet looks to be a little bit dangerous,
Yeah.
but potentially advantageous for reducing or reversing diabetes. I say let them study it.
Let 'em
What's
have it.
wrong with studying whether someone can actually reverse diabetes by increasing protein, and they might enjoy the bacon.
I guess it's not as dangerous as going to Vietnam.
So, David, are you ready for that big primary day, Super Tuesday?
The big Tuesday in the sky, John, I'm ready and I'm willing and able to vote. I don't know who the heck I'm going to vote for. I don't know who's still going to be in the race when it comes. And I really don't know.
I'll be ready.
Connecticut doesn't have Super Tuesday.
I'll be ready.
Well, that's it for another fascinating edition of Care Talk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, CEO of CareCentrix. Thanks for watching. Hey there, listeners. Want more Care Talk? There's more to be had in our other episodes, so be sure to look for those and subscribe to Care Talk on your favorite service.